Most people believe they would recognize a heart attack immediately. They imagine sudden, severe, crushing chest pain, falling to the ground, and a true emergency. But that's not what I see in real life. Many people having heart attacks are still walking, still functioning, still talking, still convincing themselves nothing serious is happening. They wait and wait and wait. They take antacids, they lie down, they promise themselves that they will get themselves checked tomorrow. By the time they arrive at the hospital, part of their heart muscle is already gone. Today, I want to talk about the three heart attack symptoms people ignore the most, the ones that quietly appear hours before disaster. Because heart attacks rarely begin dramatically, they usually begin with a big doubt. So, before we talk about the three symptoms, let's understand what is actually happening inside our body. A heart attack occurs when the blood flow through one of the coronary arteries, which is the arterial blood to the heart, suddenly stops. Usually, a cholesterol plaque ruptures, forming a clot, and there is no oxygen delivered to the heart muscle for a long period of time. And the heart muscle is extremely sensitive. Within minutes, injury begins, and within hours, damage becomes permanent. That's why cardiologists say time is muscle. Every minute matters. So, why people miss heart attacks? Well, here's the dangerous part. Most heart attacks don't look the way movies taught us. Not everyone experiencing this crushing chest pain all of a sudden. In fact, many women don't, and many diabetics don't, and older patients often don't. Instead, symptoms are very vague, uncertain, easy to explain away. People tell themselves maybe it's just indigestion, or I slept wrong, or I feel just tired. But the hesitation is where danger lives. Well, let's jump into symptom number one, pressure, not pain. Well, let's understand this symptom. Heart attack often don't cause sharp pain. It causes pressure. Patients feel like heaviness, squeezy pain, tightness, burning, fullness. Never ever say it's a sharp pain. Many patients never even use the word pain. They say discomfort. They say something just didn't feel right in my chest. I have seen patients continue normal activities while this is happening. They stop, they rest, they feel a little bit better, and then continue again. What they don't realize is that heart is struggling while they are talking. Every time demand increases, every little activity, every little stress. So here's an important clue. If the discomfort lasts more than few minutes, worsens with activity, and returns repeatedly, that's a true heart attack that need to be checked. Symptom number two is shortness of breath. So sometimes there is no chest discomfort whatsoever, but the only symptom is breathing difficulty. The patient say, I suddenly couldn't keep up. Walking felt unusually hard. I feel easily winded when I do a certain activity. And this confuses people because they think heart problems must hurt. But when the heart weakens, pressure backs up into the lungs. Breathing becomes difficult, especially common in women, diabetics, and elderly patients. So unexplained shortness of breath should always be a concern. Symptom number three. Well, sometimes when the heart speaks, it doesn't speak in the chest. It speaks somewhere else, to the jaw, to the neck, to the arm, the shoulder, the upper back, the stomach area. It's so confusing. And people think maybe they have a dental problem, maybe they have a muscle strain, they may have a GERD or reflux, but nerves from heart share pathways with these areas, and the brain misinterprets the signal. One thing many survivors tell me afterwards is this: I knew something is not right. Something wrong is happening. That unexplained feeling, fatigue, nausea, diaphoresis like cold sweats, lightheadedness, dizziness. These symptoms should never be ignored. Now, at this point, you might be wondering, who needs to be most careful? Well, we have certain risk factors, including diabetes, smoking, high blood pressure, high cholesterol, obesity, and family history. Very important, family history. But here's an important truth. Heart attacks don't check appearances. I have treated marathon runners and younger professionals with severe blockages. So now is the real thing. What you should do when you're experiencing this kind of symptoms. So if you're experiencing chest discomfort or pressure or shortness of breath or any of other kind of confusing symptoms, call 911 if lasted more than 5 to 10 minutes. Don't drive yourself. Sit and rest and chew aspirin if you're not allergic. Ambulances save time and time saves heart muscle. Here's the biggest mistake I see all the time is waiting. People wait for certainty, but heart attacks rarely provide this certainty. They provide warning. Average delay before seeking care is about 2 to 6 hours. This is very crucial for salvaging the heart muscle. Otherwise, damage will be permanent. Here's my final message. I have seen patients arrive early, receive treatment quickly, and return back to their normal life. I have seen patients wait and live forever with heart failure that could have been prevented. Your body often whispers before tragedy. You have to listen early. Okay. So if this video helps you recognize symptoms sooner, please share it with someone you care about. Because recognizing a heart attack may save a life, possibly your own. Subscribe to Dr. Nony's Power Lab and I will see you in the next video. Thank you.